Dr. O'Toole, over the past few months, I've been asking VA officials and nominees if they can guarantee that the Trump administration's plan to fire 80,000 VA employees will not result in longer wait times for veterans to get appointments and receive care. In response, the administration's nominees have told me that wait times at the VA have been increasing and reform is necessary, but they've never explained how firing 80,000 employees will help solve that problem. That's indicative of the way the administration has approached things these past few months. They have been making drastic changes without, as far as any of us can tell, any analysis or plan. Dr. O'Toole, you've worked at the VA for almost 20 years, and you're currently the VA's top doctor. Has anyone asked for your analysis on how firing 80,000 employees will affect veterans' care?
Thank you, Senator, and I appreciate the question. I am not involved in those discussions, and I will say that we actively monitor and track wait times. We actively monitor and track access.
I understand that, and again, my time is short, but the answer to my question is no, they haven't asked you for your analysis. And obviously, wait times is a piece of this, but affecting veterans' care, if somebody's been laid off who orders supplies and a doc runs out of critical supplies, that affects veterans' care, right? So have you seen or been provided with any analysis as to how firing 80,000 VA employees might affect veterans' care?
I have not, ma'am.
Have you been directed to perform or oversee any analysis as to how firing 80,000 VA employees might affect veterans' care?
Well, again, ma'am, I will say it. I am prepared here to be able to speak to this grant. I don't have the information you're asking to that.
Right, but I'm taking that you would know if you have been directed to perform or oversee an analysis, so I'm going to take that as a no as well. Last year, the VA's Inspector General released a report on several occupational staffing shortages within the VA. These are jobs that the VA was having the hardest time filling. The IG's report stated that the top clinical job in the VA with a severe staffing shortage was psychology. A whopping 61% of Veterans Health Administration facilities reported having such a shortage. Psychiatry came in third place. 47% of Veterans Health Administration facilities reported psychiatry as a shortage. As a career VA doctor, can you please discuss the role that mental health professionals like psychologists and psychiatrists play in supporting our veterans?
Thank you, ma'am. They are critical. I think that goes without saying.
Yeah.
And the complex needs and care requirements of our veterans obviously require the engagement of a very robust mental health service.
Yeah, I continue to be concerned then about the Trump administration's policies of hiring freezes, firings, and general disruption. You've talked about the exemption for about 300,000 employees, but it's really difficult to see how the chaos that is churning is going to help recruit and retain mental health professionals that our veterans really deserve access to, and you've just acknowledged, and Mr. Fisher too, has about how important they are to our veterans. Last question, Dr. O'Toole. You were the founding director of the VA's Homeless Veterans Patient Aligned Care Team program, HPACT. This program utilizes clinics with co-located medical staff, social workers, mental health and substance use counselors, nurses, and homeless program staff that form a team to provide veterans with comprehensive, individualized care. I really want to thank you for your leadership on this important work. Can you please discuss the benefits of holistic wraparound care like this and how this model utilizes expertise across a variety of fields within the VA?
Well, thank you, Senator. I appreciate those kind comments. I think the hosting of that initiative in the VA speaks to a culture in the VA of trying to reach the veteran where they are. Yep. And meet them and their comprehensive needs on their terms, not necessarily our terms. And I think the HPACT's successes in engaging those veterans and really providing that stability that allowed them to move on with their lives and engage more fully in programming reflects it, and reflects, I think, a culture of the VA that I'm very proud to have been a part of.
And I think it does too, and I think one of the things we could really work on with that culture in place, with so many veterans being willing to do peer-to-peer outreach, is reaching those veterans who haven't engaged with the VA, who we are especially concerned about as we look at the suicide statistics. So thank you very much. Thank you, Ranking Member Blumenthal.
Thanks, Senator Hassan.